So well-child visits are a way for us to meet the needs of the children and help to engage in open communication. It's a visit to check their overall well-being, and it encompasses different areas of their life like their behavior, development, their nutritional status, social connections, and any other resources that they may need as well. Parents get a chance to look at the positives about their kids too and all the things they're proud of. The frequency of the visits changes depending on the age. It can be up to 6 to 7 times during that first year. And then the second year, 2 to 3 times is average. And then the third year and on is just once a year usually, if everything's fine. There's a questionnaire the parents can pre-fill online. It just has a bunch of questions about their activity and what they're eating and what they're doing, developmental questions, safety questions like about firearms and how that's stored in the house, use of helmets, car seat belts, so that everybody's safe. And we don't expect the parents to know what's normal and what's not normal. And they can always message into my chart too if they're not sure. When they come in, they get taken back by the nurse or the medical assistant, and they'll start by taking their weight and their height, and then they usually take their vitals as well. They will go over any other questions that haven't been filled out. And then after that, the provider will come in. We'll go over everything again. Basically, we cover everything from head to toe. We let the child know that we're going to examine their heart and their lungs and look at their ears and their mouth and nose, their belly, and their private parts are also part of that exam if the parents feel comfortable and they give consent. And then we also check their strength and how they're walking, and sometimes we'll check for scoliosis depending on the age as well. So vaccines are a standard part of the well-child visits, and these are all vaccines that have been studied and have plenty of research and evidence that shows that it's a safe schedule. That's why we recommend the routine schedule. Children that have anxiety and sensory issues, we may just go a little slower or give them the information step by step. That way they know what's coming up. Generally, we also can encourage parents to bring in different objects like a comfort toy or headphones. Over time, they get more and more comfortable. So it's just a process, generally speaking. The parent and myself, I think we both can try to help the child feel involved in their appointment by asking them questions. Sometimes they take a little bit of time to open up, but we just try to keep them comfortable. Parents can support their child during the visits by being calm themselves, because the child can pick up a lot. So just showing that this is okay, this is a safe place. Encourage your child to be very involved in their appointment by talking to them ahead of time and seeing if there's something they wanted to talk about specifically. So a well-child visit helps a child to get used to going to those visits and developing that bond with the parent and the doctor together, so that when they get older, they're not afraid to go out and get the help they need. What I love most about working in pediatrics is the impact you can have on the overall long-term well-being of a patient, being able to help the parent and the child to do the best they can together.